The shoulder is a ball and socket joint with a large range of movement. Such a mobile joint tends to be more susceptible to injury. Shoulder pain can stem from one or more of the following causes: strains from overexertion, tendonitis from overuse, shoulder joint instability, dislocation, collar or upper arm bone fractures, frozen shoulder, pinched nerves. Natural treatments for rotator cuff pain or injuries. A study of serious injury of the rotator cuff of young athletes through contact sport shows that through the proper treatment, most can get back to a normal routine to include sports. However, early identification and efficient management are critical to achieve the best results, according to the medical journal Sports Health. These injuries may initially be dismissed as brachial plexus neuropraxias or cuff contusions, particularly in the football population. If overlooked, the rotator cuff tear is likely to progress and may become irreparable by the time of diagnosis. But rather than opt for steroid injections or even surgery, I strongly encourage you to take advantage of the following natural treatments. In fact, it's been reported that approximately 50% of patients are relieved of pain and experience improved function in the shoulder through non-surgical methods of treatment. Keep in mind that strength building through physical therapy and special exercises may be required to regain normal shoulder function. 1. Ice. If you know that you've injured yourself, make sure you apply an ice pack to the area immediately afterwards. This will reduce inflammation and swelling. If the ice pack or bag is extremely cold, cover the shoulder with a thin towel or clean cotton t-shirt. Apply for 15 minutes every other hour for the first few hours, and then 3 times a day until you're free of pain, this including after any physical therapy or exercising. 2. Rest and spend less time doing normal activities. Often, the initial step to any injury, or even potential injury, is rest. Rest could include more sleep as well as limiting overhead activities. Your doctor may also prescribe a sling to help protect the shoulder area by keeping it still. This can also help you avoid trying to use it during this rest period. 3. Ultrasound. To speed blood flow to the damaged tissue, reduce inflammation and increase healing, an ultrasound can heat up deep tissue and address rotator cuff pain. 4. Heating pad. Heat can improve healing. A physical therapist may also use a moist heating pad for 15 to 20 minutes before exercise, and it can be useful to do this at home too. 5. Physical therapy. Overall, physical therapy and occupational therapy may be the best treatments long-term, and could get you back to a normal routine and restoration much faster than steroid injections or surgery. Evidence through clinical trials suggests that physical therapy with prescribed exercises can help provide healing of conditions such as shoulder impingement, rotator cuff tendinopathy, rotator cuff tears, glenohumeral instability, adhesive capsulitis and stiff shoulders when applied to rehabilitating patients. 6. Anti-inflammatory foods and natural painkillers. While drugs like ibuprofen can reduce pain and swelling, they're also dangerous. So, when possible, opt for non-synthetic methods such as avoiding highly inflammatory foods. Consider anti-inflammatory foods that will help you heal much faster while providing other useful benefits to your health. There are some great natural painkillers for shoulder pain and tendonitis in the rotator cuff that can be very useful as well. 7. Essential oils. One such natural painkiller is peppermint essential oil. By applying a peppermint essential oil rub twice daily, you can provide the rotator cuff with natural healing alternatives. Peppermint oil is a very effective natural painkiller and helps relax the muscles. Simply blend it with coconut or almond oil, and rub onto the affected area. Other effective anti-inflammatory oils include arnica, evening primrose and lavender oils. 8. Strengthening. Specific exercises can help restore movement and strengthen your shoulder and the muscles and tendons that support it. The goal is to strengthen the muscles that support your shoulders so that you get much needed pain relief while preventing additional injury to the area. 9. Stretching. The other side of the rehab coin to strength moves is stretching exercise. This can help improve flexibility, and range of motion, but keep in mind that it takes time and your commitment to performing these exercises 1 to 2 times per day, 3 to 4 times per week. Also, while you are likely to feel discomfort, if you feel any pain when performing these exercises, please stop immediately and consult your doctor. 10. Acupuncture. A 2012 study done by Memorial Sloan Kettering Department of Epidemiology and Biostatistics aimed to determine the effect of acupuncture for 4 chronic pain conditions: back and neck pain, arthritis, chronic headache and shoulder pain. The researchers reviewed clinical trials involving over 17,000 patients, and the results showed that patients receiving acupuncture had less pain than patients in the placebo control group. The conclusion was that acupuncture is effective for the treatment of chronic pain, and is more than just a placebo effect. Therefore, it's a reasonable referral option for doctors.